Good afternoon. I would like to welcome everybody to our discussion this afternoon entitled Public Health, Rural Latina, Latino, and Latinx Populations, and Regional COVID-19 Response. I am Dr. Charles Daramola, Professor and Program Director of the Public Health Program at Bakersfield College. I'll be one of the moderators of this program, along with one of our students, Isis. Isis, please introduce yourself.
Yeah, hello, my name is Isis Forney, and I am actually a new graduate from nursing school from BC. I graduated in December, and I decided to take extra public health classes with Dr. Daramola, and I really enjoyed those. And I am happy to be part of this today because obviously I am a Latina, and I would just like to hear some answers from our panelists.
You're on mute, Charles.
Thank you. So I said, thank you, Isis. And I said, I would like to thank our distinguished panelists for being here today. And I would ask them to kindly introduce themselves. So we can start with Reyna at the very top.
For sure. Thank you so much, Charles, for inviting me today. My name is Reyna Olaguez. I'm the Executive Director of South Kern Sol. South Kern Sol is a nonprofit news organization that focuses on training young people and equipping them with journalism skills so that they could tell their stories, their own stories of their communities. The young people that we work with live in the most impacted communities. They live in Delano, they live in Arvin, Lamont, and McFarland. And so we have young people from all over Kern County. Our website is southkernsol.org. Please visit us.
So Emmanuel, would you like to go next?
Yeah, hello. My name is Emmanuel Alcala. You call me Emmanuel, and I'm the Assistant Director for the Central Valley Health Policy Institute. I'm also a PhD student at UC Merced and a Robert Wood Johnson Foundation Health Policy Research Scholar, and most of my research is around place-based and social determinants of health here in the San Joaquin Valley. Thank you for having me so much. I greatly appreciate this opportunity.
Thank you, thank you. Thank you so much for being here. Yeah. Jennifer?
Hi, good afternoon, everyone. My name is Jennifer Martinez. I go by Jenny. I'm a PhD candidate over at Portland State University in Oregon, studying public policy. My research has to do with, a little bit of political rights across borders, a little bit about how communities stay, engaged with each other through remittances and other forms of care. My title here is Cadillac Roots quote producer. In 2019, I worked on a story about farm worker retirement with Cadillac Roots, which is part of California Institute for Rural Studies. But since then, I've also done a little more work with CIRS on a COVID farm worker study that happened across California, Oregon, and Washington. And I was facilitating the Oregon study. So I'm really excited to be here. Thank you so much for inviting.
Thank you so much for being here. Diona?
Good afternoon. Thank you so much, Dr. Daramola, for having me on today. I'm Diona Torres. I'm the Executive Director of the UFW Foundation, a sister organization of the United Farm Workers Union. We've now been around for about 15 years. It's our quinceañera, pretty much. We have been doing a lot of work augmenting the advocacy that the United Farm Workers Union has historically done. Immigration reform, for instance, we just got our bill, the Farm Workforce Modernization Act, passed through the House last week, which was a wonderful victory. And in addition, we've been doing a lot of advocacy work at the state level and federal level on other types of farm workers, labor protections, et cetera. And during this pandemic, our outreach and education work has evolved to also include work around COVID-19 and vaccination. We've set up a pandemic relief program where farm workers who are undocumented were able to access financial assistance. We've up to this point distributed over $17 million in cash assistance, emergency relief food distributions, 900,000 mask distributions. So needless to say, this pandemic has kept us more than busy, and we're very, very excited to now be moving this work to the vaccination process, and have been advocating throughout the country to ensure that farm workers are a priority for vaccination. Thank you so much. Dr. Daramola, you're on mute.
Keep on doing that, right? I think by now, it's Andrew's fault. Anyway, so I said we were just up at in Delano 2 weeks ago, UFW, with the vaccination of farm workers. So thank you so much for all of you for all you do. All right. So this afternoon, the format will be the following. What we've done, we've reached out to our students and gotten questions from them, what they would like to ask you, the panelists. So Isis and I will be asking the questions. So we'll tell you who the person is, you know, their major, and then we'll ask their question too. And this is open to the group. So you guys decide, you know, who may be better suited for one question or the other. We did ask them for, you know, specific questions for individuals specifically. They said, no, we'll make them general. So we have general questions that are open to the group. So Isis, you have the first question.
Okay, so from Melissa Garcia. She is studying bachelor's degree in public health. Why do you think Latina, Latino, Latinx populations have mistrust about COVID and COVID vaccine, even though they hold the highest cases of COVID in Kern County?
I could take that one. I am also a member and a founding member of the United Against COVID Coalition. And we started this coalition last year to conduct outreach to our communities. As many of you heard, you know, we applied for a grant with the county, and Supervisor Scribner rejected the proposal, and we weren't able to do that much needed outreach. As a result, you know, I really do feel that we lost a lot of lives because many folks did not get the outreach that they needed. And so I think that there's not a lot being done, especially to target our communities with outreach. You know, I think our farm working community needs specialized outreach. They need the outreach in Spanish. It takes about 7 times for a person to take action on a certain item to make a change. And so if we haven't been educated on this, there hasn't been a robust communications campaign. It's lacking. And I think that it didn't start early on. And so we missed it. We missed the boat there. Now we're just trying to catch up, and we're late in the game. We've lost over 1,000 lives here in Kern County already. And I think that's, and I'll stop there for now.
There's also an added, in addition to what Reyna said, the fact that there has been a lot of fear in the community. I know one of the top questions that we continue to get from farm workers and other community members is whether legal status is required, and a lot of practical questions around that issue. And so knowing just the terrorization that the Latino community and immigrant community experienced over the last 4 years and even beyond that, you know, we really need to address that straight on. And also just the vast majority of farm workers are uninsured. And that's the second question that we tend to get is, well, I don't have insurance. Do I have to pay something? And so there are as months have passed now and more people are getting vaccinated, the questions have evolved to being more practical questions about whether I'm eligible or not. And so the more boots on the ground that we have and resources and intermediaries that are trusted, the better.
Yeah, thank you both. And like you both said, you know, every day that we don't do something is a day that we're losing somebody, you know, and we need to find ways, one, to meet the people where they are, and then to be able to answer these questions. I just saw on the CDC website that, you know, you cannot, I think I saw you cannot be charged for a COVID vaccine, but it's not well known. You cannot. But I saw it there. I said, well, I did not know that. So this kind of information that we're talking about is important to get not only us to know that information, but to get it out to the community as well. All right.
Professor, may Daramola
Sure.
add something
Sure.
really quick? Yeah, I also just wanted to add, in addition to what Diana and Reyna mentioned, and what you just mentioned right now about information, that's something we found, you know, in the COVID-19 farm worker study, and specifically talking about Oregon, but in California too. You know, in Oregon, farm workers speak over 32 different indigenous languages, Mesoamerican languages, to only Mexico and Guatemala. And so not only are we talking about information gaps in terms of, you know, having this very specific language around COVID, needing to reach communities, but in addition to that, often those were not, you know, the interfaces have not been provided in the languages, so that information is given in the languages people speak. And so I also just wanted to make one quick connection also to connections back home. Our survey asked about remittances and just like how people are navigating the pandemic here, but also how they're relating back to their relatives back home. And, you know, in Mexico, there was a big article on the Washington Post that spoke about how a lot of people in Mexico were dying once they reached the hospital because they were getting there too late. And there was a lot of information, or what the article was saying is that people distrusted the healthcare system. There was a conspiracy theory or misinformation, right? That, you know, when people went to the hospital, they would be injected on the knee with, you know, with the virus, and they would pass away. And so this was, you know, these type of things do snowball, and those do get sent back and forth between countries. But at the end of the day, I think, you know, what's at stake here is deep distrust in systems, and, you know, fairly, right? I think during the Trump administration, as Diana mentioned, there's huge just fear, you know, for sure, everywhere, right? From public charge, from being excluded from relief funds, and that makes real dangers, right? We know that our systems have deep-rooted racial intentions, but just having those narratives up and centered, you know, through the presidency and trickle down, that really makes deep, I guess, reactions in people, right? And so that distrust and that loss of legitimacy in institutions, I think, is still something that we need to continue to work with. And local governments, local communities, especially, you know, state governments, need to figure out how to regain that trust. And so that's something else I wanted to just add.
Yeah, and just to add, like,
go ahead, yes,
I 100% agree with all the statements that have been said, and if I could just add that there are promising models that, and I'm sure that my fellow colleagues here would agree that, you know, community health worker or promotoras could potentially help with these types of barriers of like linguistic access, cultural access, really the lack of representation of Latinos or people of color in the medical system. However, these structures or infrastructures are vastly underfunded, and there needs to be a larger concerted effort to fund these types of ways to fill in this gap.
And I totally agree. And I think, you know, a lack of representation is, like you just said, Emmanuel, a key point. Because if you don't have folks who understand the folks in the community, who can't speak their language, who can't identify with them, you know, we teach in one of our classes, in our public health class, some cultural competency. That's important. That's why we went to, we did some volunteering to make sure that not only we teach it in the classroom, but students got to see it in real life. So that's a discussion we can have, you know, a lot on, going forward. Okay, thank you. So now we have a second question from Roger Jose Gonzalez Jr. He's a nursing major, and here's his question. He says, many individuals in the Latino community, I'm not on mute, right? Okay, good. Many individuals in the Latino communities work in the fields, factories, or in other jobs that require close contact. Many of the members in this community have been laid off or let go. What resources are available for these individuals and their communities?
I could talk a little bit about the different programs that we have. With the United Against COVID Coalition, we created a beautiful resource guide, and it includes all of the resources that are available for our community. Our health promotoras are going door to door delivering these to our communities. One resource that I think that just kind of launched last week is the Housing Authority's rental and utility assistance program. Regardless if you're undocumented, folks could apply to that program. And then there's also the Housing for the Harvest program is launching again April 1st. This time, the program is for folks who are impacted by COVID and can't work. If they they have the option to shelter in their home or in a hotel room. And they get financial assistance to shelter in their home, in the hotel room, and $500 to shelter in their home. And they also get food. And 211 has food available. There's been different, they launched a lot of food banks across the county in partnership with community-based organizations. And then, we also are starting to see more clinics pop up across our communities. And that's also important. We just held 3 vaccine clinics this past weekend, and we hope to host more very soon.
Thank you. You mentioned a number of resources, Reyna, that I didn't get those down. Andrew, can we get those in the chat, or should we get those later to make sure make those resources available to those who might need them? Is Andrew still here with us?
Yeah, we can maybe have Reyna email those to me, and I can make them available on the Nieto conference webpage.
Excellent. Excellent. Okay.
I'd also like to add that, a lot of the barriers that we're seeing related to just vaccination have been the registration process. And so the UFW Foundation at the beginning of the pandemic set up a call center where individuals can call regarding any workers' rights issues to just help navigate. Like if there's something going on at the workplace, you don't have soap, where there's an issue about safety measures that aren't being followed, they can contact our call center. That's also somewhere where we've been utilizing philanthropic dollars to be able to provide financial assistance to families that are contracting COVID or have other financial issues due to the impact of the pandemic. And we've also been able to set up a text messaging program where people can get information about where there's food distributions or mask distributions, etc. So our toll-free number, I can put it in the chat. It's 877, I know it in Spanish, 881-8281. Have to think through here. And then we've had farm workers text message the word esencial or essential to 877-877. And so that's where we've been providing a lot of information and also surveying workers about what they're seeing on the ground, what they're experiencing. And we're then able to utilize that for our own advocacy work with the public health department or at the state level or at the federal level. So it's really been a way to engage workers to not just get resources, which is very important, but to also engage in the problem solving, to share their stories, to ensure that their input is contributing to systemic change. So I'll go ahead and put that in the chat.
Yeah, please do. And if you can also send it to Andrew as well, please, so we can have that. Well, I guess once it's in the chat, it'll be okay, but just in case, So I think it's important to make sure, I think one of the key things is, so there are resources. So let's make sure that those who need them know where they are and have access to them. So that's what I'm stressing. Either we have it in the chat or it goes to Andrew so we can make it available to those who need it. Right. Thank you so much for that. Anybody want to take that still? We're good with that second question?
I wanted to just make an addition,
Sure.
not in terms, I guess I could talk a little bit about the resources that were available in Oregon, which I think many of those were similar to the ones here in California, with, of course, local variation. But of course, the rent relief program was really popular. It has been really popular. And in our study, we found that that was one of the core pieces that farm workers kept telling us that they really needed assistance with, and the assistance they used. And so in Oregon, we also had the quarantine fund, but then there was like some issues in terms of when do you actually quarantine, right? Is it 2 weeks? And so that was another something that a lot of local elected leaders put together, and at least there was some type of base so that people can actually take time off when they became infected, right? And
Sure.
so that also became really important. But one thing I also wanted to say is that, you know, based on legislation, COVID rules, farm workers were eligible for sick leave, right? But a lot of times that information didn't make it to them, right? And so there was some lack of information from the employer to the farm worker, and so that we know exists, right? So that is something else, right? That farm workers have rights, but often farm workers don't know about them. But one more thing I wanted to just add is that farm workers told us that they lost months and weeks of wages in Oregon, right? So that was 76% of farm workers told us from the 300 people surveyed. That something similar like that happened in California as well. But when we look at gender by gender, women were especially telling us that they lost month of wages. And so I think when we're thinking about future relief, because, you know, relief, we need a temporary relief, immediate relief, and then looking forward, that's definitely going to be something really important as we look into the future. And of course, just bringing it back to the CalAg story that I did on retirement, you know, a lot of farm workers don't have access to retirement, but even if they did, the idea that women lost more wages, whether it was to virtual school or whatever it might be, that immediately already adds an additional layer of disparity in terms of retirement and future prospects. So I just wanted to add that as well.
Again, excellent point. Thank you so much. I'm seeing the resources in the chat, which is great. Thank you both for putting those in there. I appreciate that very much. Isis, I think you have the next question.
Yes. So this is coming from Edward Heredia. He is majoring in fire technology, and it's like kind of like a multi-question. So just bear with me. People in rural area are often in close proximity to animals, whether livestock, pets, or wildlife. Do we know if COVID can spread from people to certain types of animals, including pets? Where it can lie dormant in the animal host and reinfect humans in the future? Is the risk of animals spreading COVID-19 to people considered low?
Sorry, who wants to take that one first?
I could just say from the CDC, based on the limited amount of information that they have to date, the risk of animals spreading COVID-19 to people is considered to be low. But I could not add anything else to that because that's all I know.
Yeah, I can add a little bit, just a little, that you're right, it is low. And then we don't know enough yet. You know, I think the big thing is the sayings, because I think, as you mentioned, the CDC website, it says what we know, what we don't know. So there are things they don't know yet. I'm assuming they're looking at these things. So that's a great question. Data suggests it's low, but we don't know enough. And when we do know enough, we'll be able to share that information.
I have, so
yeah, sure.
I really have not anything to add about like the communicable disease piece on this, but I'm gonna hijack this question because it's an interesting question, and a lot of people go to like direct spread when it comes to communicable diseases like COVID-19, but it's really the patterns of spread are so similar to non-communicable diseases. And to me, the broader question here might be just as important, where we think about specifically Latinos who tend to have lower paying jobs, therefore tend to not be able to afford larger homes, tend to have multi-generational families living within a small unit. And then therefore the spread, is these people are at higher risk. And to counter that with a more affluent family who tend to not have the grandparents at home, have smaller families, the siblings have their own rooms. It's much easier to practice physical distancing in these environments. And to me, I think that's kind of the bigger cause for concern, even for COVID-19. But yeah, we don't, like you said, we don't know too much about the spread from species to species.
Great point. One thing I did either read or see recently is that I don't know how related this might be, but looking at developing countries and saying in many of those countries that at least the serious disease and death is much lower than you would expect than a developing country. One of the things they said is if you live in an environment where it's a small environment that with a lot of people in the home, one of the things that you want to do if you can is to, I don't know how easy it is, but at least California is quite warm. Open as many windows as possible, as much as possible. Be outside, let ventilation in. It won't stop it. It won't stop the spread. But they do say because many of the developing countries don't have air conditioning, they keep the windows open all the time, the doors as much as they can. So there's a lot of cross ventilation. So that may be some lessons for us as well. As one of the things that we could do. We don't know how much it's going to change things, but that's one of the things that we could, consider doing, in our communities. Okay. So next question. This is question 4 from Shalay Hubbard, a sociology major who's African American, and she said, as a member of the Black population, I have noticed that a lot of Black and brown people have been affected by the COVID pandemic at higher levels than the majority population. So my question is, how has COVID-19 affected Black and brown populations? And how have the populations responded to the COVID-19 vaccine? Also, another long question. Also, what are your thoughts regarding this pandemic and its effects on society as a whole, as well as on different races? So I think she's looking at Black and brown populations, the effect that COVID has had on them, and how the community has responded around, COVID-19. Let's take that. Emmanuel, you want to go first on this?
I can. It's more of the same take. It's to me, it's all about these social determinants of health and the economic opportunities, the education opportunities, all are at the root cause of any of these diseases. And without a doubt, in terms of how races are impacted by COVID-19, unfortunately, we've seen the ugliest types of racism against Asian Americans and Asians in our country. And that's such a different impact than I think what this question is addressing, which is literally like the health outcome, where African Americans, Black populations, and Latinos have died at greater rates than their white counterparts. And part of that is, for example, maybe it's not the case that they're more likely to get COVID-19, but people of color tend to have comorbidities such as hypertension and diabetes, which when those two things kind of interact with each other, the likelihood for death is much greater. Again, tying back to come back full circle, it's really about economic and educational opportunities for people to allow themselves the opportunity to combat these environments.
Sure. Determinants, as you mentioned, in terms of there's environment, there's genetics, there's social, education, all those things. Yes, great point. Yeah. Anybody want to add to that in terms of Black and brown communities?
Sure, I can add to that.
Sure.
There's so much to say on this arena here. So where do I begin? I think just looking specifically at occupation and the types of occupations that people of color are really taking, right? So we have a large population of farm workers that is likely to be Latino. We also have, other low-wage work that it hasn't stopped from day one of the pandemic. And so many of those positions that require someone to be out and about, and individuals who don't have the luxury to work from home a lot of the times are people of color. And so I was so excited to see the study from UC San Francisco, which really focused on occupation. And sometimes occupation is not something that's being captured as critical data as related to COVID-19. And so that showed that Latino Californians experienced a 36% increase in mortality during the pandemic. But if you look specifically at Latino food and agricultural workers, that was a 59% increase of death. So you really see the impact that the pandemic has had on the Latino population, and especially on low-wage workers. And so part of what we're seeing is this exacerbation of vulnerabilities that already existed prior to the pandemic. And a lot of the work that needs to continue to be done really is that advocacy piece. It's so essential. Just prioritizing individuals, making sure that systems are accessible. The vaccine process had been so, and continues to be so frustrating on so many levels, both at the county health department levels and then at the state level, where it was critical that we were expressing collectively. And I know the UFW Foundation, I serve on the Community Vaccination Advisory Committee for the state, and just reiterating over and over again that farm workers needed to be prioritized, that they're constantly mobile, that they're moving from county to county, that they don't often have the types of opportunities to live in households with their own families. They're traveling the same vehicles with people who don't live with them because of necessity. And so, it's so important that, okay, that's now in the guidelines. Farm workers are priority. They're now part of the vaccination process. But then when you get into the nitty gritty of, okay, are they now accessing it? Well, there's registration processes that are in place that are challenging. And if you don't have the digital literacy required to hop on a website and continually try to get an appointment for yourself or your family member, then you're not going to have the type of access to an event. If you don't have a vehicle to get to a vaccination event and it's not close to you, then how are you going to be able to access a vaccine? And so really establishing those systems on the ground that include many of the community-based organizations and unions and individuals and organizations that have built the trust, that are trusted messengers on the ground, is so critical. But it's been a slow process, in my opinion, to really get the level of resource allocation that's necessary to reach people of color, to provide them with the opportunities when they're available, when they're not working, not just at the work site where they feel compelled that, oh, I have to get this done because my foreman's telling me I have to, but to get the level of information and your questions answered is so important. So I just think that there's so much work to be done to really capitalize on the resources that are coming our way. More and more vaccines are coming. However, we need to ensure that they're going to those who are the most vulnerable. And that's really the space where we're in this state. And then at the county levels, I mean, you know, it took a while to get Kern County to really be able to trigger the farm worker component. And so it's just continually as advocates and as community members to voice the important points that we're seeing in our own families and our communities to put that pressure to do something. So sorry, it took a little longer than I got riled up.
No, listen, that's great. I think accessibility, that is so important. Getting access, you know, because you may, like you just said, you know, and we've heard stories that, you know, oh yeah, there's vaccines in this area, and those who are getting it are those who have access to computers from outside the area coming in and getting online. We've seen that. So whether it's today or tomorrow, you know, in the future is what I mean. We have to look into that and kind of see, you know, is there how can we improve this accessibility? How can we make sure that, like you said, nonprofits, that people know that they're there, they know how to get to them? You know, I have some ideas that I'm thinking about, because people have phones. They may not have computers, but they can call. You know, we cannot get away from, okay, it's all computers now. You know, if you got a computer, you can get on and do stuff. If you got a phone, you may not be able to. So we need to keep on, make sure that we include everybody. So I'm sure we all have great thoughts. Maybe beyond this conference, we should talk some more of things that we want to do. You know, I think it's important. Okay, thank you for that very much. Yeah, sure, Jennifer, go ahead. Yeah. Sure, please.
So I just wanted to take a moment to talk about disproportionate impact, right? We keep hearing that BIPOC, Black, Brown, Indigenous communities were disproportionately impacted by the pandemic. But at the end of the day, so for me, as I'm working through my dissertation, and of course then COVID happened, and you know, everything just turned upside down. I found Necropolitics, right? The book by Achille Abembe, really critical in trying to understand the policies that allow disproportionate impact, that allow disproportionate death, right? So really the politics of death is what necropolitics it is described by Abembe, right? And so to me, you know, I'm thinking of the Defense Production Act that was implemented to keep meatpacking industries open. I think about the term essential, right? That was that then deemed all farm workers essential, and so therefore they had to keep producing, right? And so, you know, this is all embedded. I think it's really important to not like lose sight of the National Labor Relations Act, right? And the exclusions of farm workers that really come from this anti-Black sentiment, right? Is a vestige of enslavement. And so when we think of disproportionate, I think it's really important to think about those policies based on race that have immediate impacts, right? And so one more thing that I just wanted to add is, and I think Diana already mentioned this, is, you know, in the Centro Valle, in the Central Valley, where my parents live, we all know, you know, quality of air is bad, is dismal, right? And so we're talking about COVID-19, a respiratory virus. And so that already immediately adds another layer of impact. We're talking about, you know, some diabetes, things like that, obesity, right? In communities where there's food deserts, in communities where we know that there's already folks suffer from diabetes, right? And so I think that's all really important as well to when we think about disproportionate death. There was a article out of Princeton University that found that the Black and Latinx population, their life expectancy has already been shortened by 3 and 2 years, respectively. And so I think as we're thinking about our abuelitos, the generations of people we lost, tios, tias, parents, you know, elders, it's really important to think about what that disproportionate death means and where that comes from. And in addition to that, I just wanted to make one point in the CalAg's story on retirement. I interview a farm worker who's a mayordomo. He's a foreman in one of the cuadrillas. And so we lost him during COVID throughout the pandemic, but not because of the pandemic, but because of mental health issues, right? And his struggle to get mental health care access. And the Latinx community still suffers from from not being able to access mental health resources. And so he, unfortunately is no longer with us, and he left us, right? He committed suicide. And so I think that's really critical. Those are the collateral damages of the COVID-19 pandemic that the numbers don't tell us, right? All the other folks that we lost. And so I just wanted to say those comments just to also kind of instigate what, the policies rooting this disproportionate impact.
And if I could,
Reyna? Yeah, please, go ahead.
thank you, Dr. Daramola. I think one of the things that we need to make sure that we do is that we learn from the pandemic. We don't want to go back to normal. The normal was not good to Black and Brown communities. Mm-hmm. I think that is critical. We need to start prioritizing communities of color. We need to invest in communities of color, and we need to hold our elected officials accountable. If they are not prioritizing all of the communities that they serve, then they should not be in these positions of power, because they blocked essential money to our most essential workers. And I just want to make sure that we don't want normal. We want a new normal that is inclusive, that includes Black and Brown communities.
I totally agree. Thank you for saying that. I've been here about 2.5 years. I've been saying, how is this possible? Certain things that I see, like, how is this still possible? And I think what you're alluding to is that, and I tell my students, hey, look, if there are people representing you, get out there and vote. I know it's another topic, but it's all related, because with power, those who are in power make those decisions with the money. And if there's somebody who's representing you and is not doing what's right for you, get out there. They should not still be there. And I don't tell them to go one way or the other. I said, if there are people who were there who are not doing right by you, get out there and vote. That's one of the ways you're going to be able to make change, is to put the right people who care about you in those positions. And again, I don't tell them one way or the other, but for them to actually be informed, be engaged, and do something. Thank you for saying that, Reyna. It really, it animates me. I got here 2 years. I said, how is the air so bad for all these years? Isn't anybody doing anything? Anyway, I think that's another story. So, all right. Anybody else on that? Let me stop. Anybody else want to say anything on that topic? Okay. Isis, I think you have the next question.
Yeah, I do. Well, Professor, we're a valley. I don't think they can do much about the air, the air quality. All the LA smog comes this way. They would have to build some kind of machine to suck it all up there before it gets to us.
Trees, Isis, trees. I've been thinking about that. Trees. Anyway, go ahead.
All right. So the next question is from Jaspri Angela Kaur. She is a biology major, and it's also a multifaceted question. This question is for the whole panel. My mother's side of the family is from Mexico. I was wondering if my family members are eligible or will be eligible to receive COVID-19 vaccine, even though they are undocumented. My next question is, how do we prevent Hispanic Americans from being reinfected by the virus? Finally, who is our most vulnerable group in the Hispanic community that we need to have vaccinated quickly?
Big one. Who wants to take that? Any of you can go.
I could take it. Everyone qualifies for the vaccine regardless of documentation status, and documentation status should not be asked. I think that there's a misconception that the vaccine is free. The vaccine is free, but providers could charge an administrative fee. And we saw this in Lamont. There was a clinic charging $35 per vaccine administered. And so that's why we needed to, community members were not going there. And so this was keeping our Lamont folks away from that particular location. And so we saw a location in Arvin come in months, a few weeks later after the vaccine rollout happened. And that was one of the most impacted areas. I think that in order to avoid being reinfected, I think we need to just know that COVID is still not over. COVID is here and it's alive and it's well. Today, yesterday, it was reported that about 15 people died in Kern County. And I look at these numbers every day, and I think we should be blasting them out to alert folks. On Sunday, it was reported that 32 people died as a result of COVID in Kern County. These numbers are outrageous. Outrageous. We're already almost at 1,100 deaths in Kern County, and most of the folks who have died are Brown and Black community members, our most vulnerable community members. So I think that we need to prioritize communities of color equally. We need to make sure that we get the vaccines out to these communities and make it accessible to them. They want to feel invited to the clinic. When we were doing outreach for our vaccine clinics this past week, we learned that community want to have a conversation with you. They want to feel that sense of community. We got messages through Facebook. We got phone calls. We answered questions by going door to door, and we exceeded. We got more than 800 people come into our clinics. We couldn't serve them all, and so now we're looking to our communities to get more vaccines. We're trying to work with Kern Medical, with Adventist Health, or the county, or the state again, to see how we could bring more clinics to Lamont, Taft, and other communities that need them.
Very nice, thank you. Anybody want to add to that? I'm sure there's more to add to that. Jennifer, you want to?
I wanted to add just one piece to what Reyna said is just want to flesh out the importance of community-based organizations throughout this whole pandemic. They've really been the ones responding, being the liaison between actual local governments, state governments, programs, and the community and the folks. And so they have been critical throughout this pandemic and will continue. They should be continuing to be funded as we recover, in the future from this pandemic, which is going to take decades, right? And so I think it's really important to center CBOs, especially in Kern County. Just yesterday, I was at a community meeting for an unincorporated area water utility meeting, right? And it was a community-based meeting. It wasn't for the board, but there was so much resistance from the utility company's board to just give basic information like their bylaws. And so, we need to remember that in Kern County, there's still that entrenched resistance. And so CBOs are definitely the liaisons, and they have definitely been critical. So I just wanted to say that.
Thank you for that, Jennifer. Thank you. And by the way, please put your book, the book you mentioned a few minutes ago. Can you put that book in the chat room, in the chat, please? Thank you. All right. So we had question 5, right? So question 6 is Alexa Velasquez, a nursing major. She says, and I think there was somebody alluded to this earlier, why weren't agriculture workers being protected like a first priority, in essence, receiving the same urgency as frontline workers when COVID struck, due to their being, I guess you said, more exposed, so exposed more to the virus? Why weren't they put as first priority to receive the vaccine? So because, just to add to her question, when it was stay open, you're essential because you need to stay open because you're essential. So when the vaccines come, it should be, well, you get them first because you're essential. But I don't think we saw that same sort of order. So what do you guys think about that?
I can speak to that. I mentioned that I'm on the Community Vaccination Advisory Committee for the state, and a lot of the data that we were being presented by the California Department of Public Health was very much age-based, right? The most people that were dying were of 65 years or older. And a lot of the advocates who were representing vulnerable communities, we were expressing, okay, well, what happens when you disaggregate the data of those who've died who are 64 and younger? And so where's the occupational data that shows that? But that's where we were seeing that a lot of the data wasn't being collected due to occupation, which was why I mentioned how excited we were about that UCSF study, because what they did is look at death certificates of individuals who died from COVID-19, not necessarily data that had been captured through other methods. And so it really demonstrates that sometimes data that's being presented, isn't always the data that really gets down to what is really happening on the ground. And so the state had been looking at different ways to be able to approach the problem. And so we had advocated to get farm workers in as soon as possible. So we were able to get farm workers in at phase 1B, tier 1, which is the tier where we're in right now in Kern County and the rest of the state. And at one point, there was a whole discussion of like, oh, the federal government saying we need to focus on 65 and over. Let's take a look at whether we should just do an age-based preference system. And there was a ton of pushback. Right? Like we need to look at the fact that there are individuals who are working in low wage work, that are doing work that is exposing them daily. And we need to be realistic about the fact that those who are dying, especially those who are 64 and younger, are people of color. And so we can't just look at age. It's not every 65 and over year old is as vulnerable as others. There are people who can be at home, who have the means to stay at home. Not everybody has that luxury. And so I think that there was a lot of back and forth with just data that was being captured, but that was not speaking to race and how to address occupation and race to make sure that it was an equitable vaccination process. And it's a day-to-day thing. It's like a weekly thing, right? There's more data. This is what it's showing. And so one of the things that I think is going to be very beneficial right now is the fact that there is a vaccine that just requires one shot, the Johnson & Johnson vaccine. And so the quicker that we can get as many people vaccinated, especially in rural areas in the Central Valley where there's been a disproportionate impact of the virus, that we really look at the resources that are accessible and cater them to those who need them most. We were hearing from farm workers, can I get the one that's one shot? I don't have the luxury to be going to
come back again
to wait, right? And so yes, we're going to have to continue to stay on top of the state and the third-party administrator, Blue Shield, to ensure that the process is equitable, and there's still work to be done for sure.
Yeah, thank you so much for that. Thank you. And having having people at the table where decisions are being made is so important. Like I think you've alluded to that. Okay, we have 2 minutes left. Okay, so I have to wrap this up. I think we'll just leave the last question out. So we have to wrap this up. I think we could have gone longer, a lot more. These types of discussions can be, sort of in depth. And I think, if you're listening, at some point, just bring us back again and let's talk about these things some more. Maybe come with some solutions and things that we can do to sort of further what's the right word to use? The improvement or the betterment, of all communities. So we can we can come back and do this again. So I thank you so much for being here. I really, really do. I've learned so much. I enjoy this. I could talk with you guys for hours, but maybe at a future date. So Reyna, Jennifer, Emmanuel, Diana, Isis, Teresa doing the caption, Andrew, thank you all so much for being here. I really appreciate it. And, I'm sure I can get you information. You can get mine as well. And we can talk some more in the future. Thank you so much for being here.